Hi, friends, and welcome to Let's Talk About Healthcare, a podcast about the challenges and the opportunities, the good and the not so good, and the moments of joy found all across our healthcare system today. And remember, it's up to all of us to make healthcare work better for everyone, one day at a time. Welcome to the next episode of Let's Talk About Healthcare with Provider Trust. My name is Dave, and we have an amazing guest today. I can't wait for all you listening in to hear a little more. We are blessed to have joining us today, D Ojeda. They are the healthcare policy advocate at the National Center for Transgender Equality, doing a ton of work with coalition partners, federal, state government officials to really advocate for structural changes that will improve the well-being of the trans community, focusing on issues such as access to adequate health coverage, to temporary housing. Prior to their work at the NCTE, Dee was named the 2018-2019 James Marshall Public Policy Fellow by the Society for Psychological Study of Social Issues, and also worked for the Senate Health Subcommittee on Primary Health and Retirement Security in the office of Senator Bernie Sanders. Dee completed their PhD, Master's in Community Psychology at Wichita State, and also has a graduate certification in LGBT health practice and policy from George Washington University as well. Dee has just continued to follow their passion for and expanding their expertise in healthcare, health minority equity, intersectionality, social justice, public policy, and does so much on a federal and state level to help advance healthcare coverage and outcomes for the trans community. So, Dee, thanks so much for joining us. We're so grateful to have you on the podcast.
Thank you so much for having me. Really excited to talk to you today, David, and to talk about what we do at NCTE, which is the National Center for Transgender Equality. We call it NCTE.
Well, then let's start there. So tell us a bit about yourself, your background, your current role at NCTE. What's a typical day in the life actually look like?
Yeah, so I'm, a community psychologist by training and have been working in the movement for about, closer to 2 years now. We've been doing a lot of work. A typical day is usually filled with a lot of meetings. I think we got more meetings after when we had the pandemic and we ended up working from home. So our schedules get filled a lot with our meetings with our coalition partners from national to state and local levels. There's also a lot of writing involved to make a case for why we need certain policy changes that could positively impact the lives of so many transgender people in the country. There are days that we hear through the grapevine that something major is going to happen on the federal level. And sometimes we have to drop everything and respond to it. But most days our time is spent working with partners to remove structural barriers that negatively impact our community.
Amazing. And so for those that, certainly including myself as well, that may be new to the NCTE, what's the mission? So tell us a little bit about the organization, what y'all strive to achieve, the work that y'all do. Just give us a quick background of the NCTE specifically.
Yeah, of course. So NCTE was founded in 2003 by transgender activists who recognized the urgent need to policy change to advance trans equality. We have a committed board of directors. At the very beginning, we just had a volunteer staff of one and donated office space. And, they set out to accomplish 10 years ago what no one has done before, and that means providing a powerful trans advocacy presence in Washington, D.C. There was a time in the LGBT movement where we were just treated like a negotiation token, and kind of, there was this push to always exclude us in a lot of these conversations when it comes to equality. And that's the reason why NCTE is here today. We advocate to change policies in society to increase understanding and acceptance of trans people in the nation's capital and throughout the country. We work to replace disrespect, discrimination, and violence with empathy, opportunity, and justice, and just, making sure our community gets the best care that they can have and improve the lives of so many people. we just envision a society in which trans people like not only just survive, but, thrive, with accepting families and communities full of self-determination over their identities and bodies, and freedom from disrespect, discrimination, and violence. And so the only way we could do that, right, is to speak truth to power and to work with coalition partners and to also have a representative voice, not only in the federal level of government, but also in the state and local levels as well.
That's just amazing work. It's amazing work, and it's just incredible to hear from you about what you yourself, and then by extension your team is really doing at the NCTE. I wanted to pause for a second and ask about a what I think is a pretty significant event that happened this week. I happened to be, for our listeners at home, I happened to be scrolling LinkedIn and ended up seeing a post from our very own D Ojeda about a meeting you had with Vice President Kamala Harris, and just continuing to advocate for the community. So first of all, what was that experience like, just on a personal level?
It was unreal. I mean, I thought working for Senator Sanders was an unreal experience, and then this happened. I didn't know, last week that I was going to sit in front of the table and have a conversation with the vice president, who's the second powerful person in the world. But I think what was so wonderful about that whole experience is the majority of us were, people of color, that are queer, that are trans. I've made such wonderful connections with people. And there's some that we're going to continue to work with because we generated so many ideas just from the little interactions we had with each other for those 2 hours we were in the White House. I think what's so powerful is that we were in this ceremonial office that's been there since the beginning of this country, right? And then you look over and you see Frederick Douglass bust in the corner, and it turns out that bust was from the vice president's alma mater in Howard University. And, and one of the things that she has said was, we want to include more items that represent communities that haven't been really represented in the White House and in government, actually. And it was just weird because I just remember when I was 19, growing up in Florida, being told that marriage equality was impossible, and I, at the time, didn't know my own identities. And to see like 10 years, a little bit longer than 10 years later, I'm dating myself, and just being able to sit in the White House and being able to tell the vice president that we have so many structural barriers within the healthcare system, and how it's really important to really invest in these communities that really does take care of them, their own, was it was just a powerful moment, not only as a trans person of color, but also as an immigrant as well.
That's incredible. And so take me to the moment, just because while I'm sitting here listening, I'm also thinking, I wonder what I would do if I got a call from the White House saying, hey, next week, this is.
Oh, it wasn't next week.
Oh yeah,
it was the night before.
The night before.
Yeah.
And so the night before, and so I just, first of all, we're going to cover so much today in our conversation. What's the feeling that sticks out when you got that call? Are you as scared as I would be, or were you just like, man, I've been waiting for this my whole life?
Yeah, it was very surprising. I would say that. I knew that we've been working for a while with the White House. I mean, we have a really strong relationship with the White House. The LGBT liaison, Reggie Greer. So yeah, he's the senior advisor for LGBTQ issues, a wonderful individual, a person of color himself. And, I feel like it's people like him, people like to look at politicians and think that they're the ones making decisions, and they are, right? But they're making decisions because they have a strong team of staffers behind them. And Reggie Greer and other people like Hannah Bristol and Vincent Evans, like all these staffers really do care about making sure policies and the work that they're doing really reflects the needs of so many marginalized communities that were quite frankly ignored, especially in the last administration. And not only just ignored, right? Completely attacked. And so I don't know, it was a lot to take in, but at the same time, it made me feel really optimistic because I feel like there are a lot of people within the White House that are so mission driven and making sure that people get the services and the care they need while having a government that reflects them. And it was a lot. I mean, it's a lot to unpack because as soon as I found out about this invitation, I talked to my parents, and my parents were super excited. For them, we came from Peru and we had, a lot of things happen that were violent and terrible, and I was only 3 months old when I moved to the United States. So to be able to carry a 3-month-old baby and then like 33 years later, they're in the White House, it's definitely a significant change, especially given what we went through before this administration.
Yeah, thank you for sharing that. I guess transitioning back to your work specifically, you and we started the conversation here is just you've been working so much, certainly with the current administration, but also just at the NCTE on creating just structural change that will improve the well-being overall of the trans community. Everything from adequate health coverage and temporary housing. Just could you talk just broadly about, for listeners that may be unfamiliar, just about the challenges facing the community, in maybe even in just both of those areas, in health coverage and housing?
Yeah. So housing was actually such a major component of our work last year because there was a lot of horrific rulemaking at the time that was happening. They wanted to get rid of the HUD's equal access rule, which protected trans people, and it was just a horrific time. And so we focused a lot on housing last year, and we're still focusing on housing this year too. But yeah, trans and non-binary people face, unique challenges within social services like healthcare and housing compared to like the broader LGBT community, not only with the providers, but also like through the entire experience in seeking services, whether it's housing or healthcare. For example, even as simple as presenting insurance and identification documents can be extremely stressful situation, especially when a patient's documentation does not correspond with their correct gender identity. And we knew from our U.S. transgender survey that we did in 2015. We're about to start data collection now, and we're hoping to get updated results in the next year. But we know that 1/3 of trans people who have shown an ID with a name or a gender that did not match their gender presentation were verbally harassed, denied benefits or services, were also asked to leave or assaulted. And that makes it difficult for many of us to even trust, service providers and staffers because of the way they react to private information. And therefore, a lot of us tend to not seek services. And this lack of trust we definitely have seen reflected in our data. More than 1 out of 5 trans or non-binary people did not see medical providers in our data due to the fear of being mistreated as a trans person. And that's significant. Healthcare services in particular are often create structural barriers as well for many trans patients. I think one example of that is how only about 27% of trans people who were assigned female at birth received a pap smear in the past year compared to 43% of the US adult population. So when like services like OBGYN are only advertised to cisgender women, it makes it difficult for masculine presenting people to seek vital preventative healthcare services. And of course, there are other examples, the US healthcare system delivery services, and then other social services like housing are not yet fully improved to create better services and safer spaces for trans people through significant and necessary societal, educational, and structural changes. But, we hope to continue to create these changes.
One of the things that stuck out too is certainly there is an accessibility challenge in getting healthcare coverage. What I heard though, and I'm curious to hear your perspective on it too, is there also a marketing challenge,
Yeah.
which is to make sure that the messaging that is coming from our doctors, from our health systems, is by nature inclusive. So that way, I mean, that statistic you just shared about just OBGYN services is eye-opening. And so do you see that from a marketing or messaging perspective as well?
Oh yeah, 100%. I mean, I think when you have inclusive marketing, it gives people a sign that, okay, these people understand what I'm going through. These people understand that enough for me to feel respected, right? In terms, and like in marketing could be so little as an intake form. It could be an insurance application form, where like, and there was just a report that just came out like 2 days ago where we found out that there are about 1.2 million non-binary people in the country. We have so many states now that have an X marker in their IDs. I have an X marker in my ID. But when you start applying to things like insurance, or like you start filling intake forms, and sometimes those, gender identifiers are not included, and it's the first sign for me that this is not these services are not going to cater to the things I need. And so, yeah, it's just so little as that, but it's also, we've also seen healthcare entities in particular really step up to the plate and say, you know what, like, not only are we going to make sure our policies reflect and is inclusive to our trans beneficiaries, we're going to also provide more programming. We're going to provide more training. We're going to make sure our advertisement and our marketing include the experiences of trans people. And that to me is so vital, because healthcare success, like success from getting healthcare services, improve outcomes, I mean, it's so related to our relationship with healthcare entities. It's so related to our relationship with our doctors. Like, you've seen, there's so many studies out there that shows that, like, the best indicator, for example, for a mental health provider to succeed in providing care to the patient is a strong relationship with them. And so when it comes to marketing, there definitely needs to be a component to it that makes it so that they could tell our community that we can be trusted. We have done our homework. We have made sure that these services are high quality enough. We're training our medical providers, our healthcare providers, to be culturally ready, and at least have cultural humility enough to say, oh, you know what, maybe I made a mistake here. You are the patient, you're the driver of your treatment. So let's make sure you have the best care that you need.
Yeah, that makes so much sense. I so appreciate that perspective. Rewinding for a second and talking through access to care specifically, we're based in Tennessee. I'm based in Nashville, and certainly some of what we've seen in 2021 so far have been a few states that have passed laws just this year that really effectively reduce access to healthcare services for the LGBTQ plus community. I would love to hear your perspective from your seat up in DC and the work that y'all are doing on just any of these state-specific laws and kind of what your organization is doing, thinking about it.
Yeah, I mean, there's a lot to cover here. I think the major issue with healthcare in particular is these attacks that we're seeing across the state. And I think what is even more insidious is the attacks that are targeting trans youth in particular. And also just the audacity to tell healthcare providers that they know better than than they do, right? In terms of medical expertise. And unfortunately, many policymakers in powerful positions are not listening to their needs for gender affirming care, and therefore are often misinformed. There's a lot of myths being pushed around. Even though there is an international standard of practice for gender affirming care that healthcare providers must adhere to, right? And ultimately, only patients, especially trans youth, and their guardians and their providers, should decide what their medical care is in their best interest. But we also seen responses from national organizations, and we've seen, and a lot of it is based on a lot of research that's been done for decades. I mean, in fact, we know that gender affirming care reduces the risk of suicide, especially for many trans youth. There was one study from the Journal of Pediatrics that found that the risk of suicide actually reduces by 70% for trans youth who receive gender affirming care. And because of research like that, it's why, the American Academy of Pediatrics, for example, and the American Medical Association and all these other medical expertise organizations all support best practice gender affirming care, especially for trans youth. In addition, I think the other thing we've done in response to these type of bills, we just established, I think last month, a long-term tool to provide, to have healthcare providers advocate against these specific bills, and more specifically, the attacks on anti-trans medical bans against trans youth. We've have this national letter with the caveat that we can address these letters to state-specific responses, and including healthcare providers from those states. So that caveat is there so that we can have this long-term tool, and we can continue to allow healthcare providers a space where they can advocate. This is a collaboration that we had with GLAMA. And so far we have over 2,000 providers who already signed on, and we're hoping to get more signatures, especially when we get closer back to when sessions are open again. So that way we can say, hey, Ohio, which by the way, this is true, Ohio has at least over 80 healthcare providers who said that this is not okay, and that maybe you shouldn't pass these type of laws, and it's just a reflection of what we're doing in response to these states. We're just as a broader movement, LGBT movement. We've done everything we can to provide support with state organizations and making sure we can pull major key players like insurance companies and healthcare entities into that advocacy space, which is difficult to do, right? Because I feel like, especially when it comes to businesses, there's a line that we need to toe, right? And making sure that corporations are not seen too political. But, we are very supportive of a lot of organizations, healthcare entities who really want to make a stance and really want to be open to that. So we've also been helping with statements. We've been helping with getting these healthcare entities to understand why this also impacts their business as well, right? And furthermore, in terms of folks in DC throughout our movement, to congressional staff, to the administration staff, a lot of them are very shaken to what is happening in these states. There are fears about litigation as well in terms of how we should respond to these attacks. However, we need to remember that the law is on our side, right? We have HHS and the Biden-Harris administration, who have recently, earlier this year, announced that the Office for Civil Rights will interpret and enforce Section 1557. And I don't know if people know about Section 1557, but it's the non-discrimination provisions of the Affordable Care Act. And in response to also the Bostock decision, which was based on an executive order that that President Biden had actually put in, like, I think his first day or second day in office, in response to the decision, which clearly states that sex discrimination also includes discrimination on the basis of sexual orientation and gender identity. And so, yeah, it's a really exciting time, because we're hoping that this is what we can use to make cases in terms of coverage, and we're hoping that this will, I mean, it's already like have done so much impact on the way we've talked to insurance commissioners, for example, around these healthcare issues.
I mean, so much detail, and thanks for going into it. It's just so helpful. So I just appreciate your perspective on it. Just sticking with the policy for a second, I'd just love to get your insight on the Equality Act. For listeners on the phone that may not know, it on February 25th of this year, 2021, it passed in the House, and now there's a push for it to go to the Senate floor. I would love to hear from your perspective, just what would you anticipate as being impacts to patients if that is indeed passed?
It will have tremendous ripples on every facet of our lives, not just for trans people, but for people of color and religious minorities as well. It makes sure that we are protected through public accommodations. It will make it clear to the healthcare industry that these gaps of care must be addressed, and they cannot continue to allow their systems to discriminate on the basis of gender identity and sexual orientation. A lot of times we get really frustrated by all this horrific rulemaking that we see with one president, and then we come and we have another president or another administration that is very, very much on our side, and wants to make change happen. And there's this great fear, right, that the next administration may not do that. However, if we have the Equality Act, we won't have to worry as much, right? Because like that means that it's codified within the Bill of Rights, and that's a big deal, because there's not a lot the opposition can do to change that, the anti-trans opposition to change that. And we also have many states in this country that do not protect the LGBTQ community. I remember when I lived in Kansas at the time, not anymore, but at the time, you couldn't claim discrimination, sex discrimination based on the gender identity and sexual orientation. And in fact, your landlord could find out that you're trans or gay or queer, and they are legally allowed to kick you out. There are employers that are legally allowed to fire you, and there's nothing you can do because the state has specifically said that they're not going to protect you. And these are even with this anti-trans bills that we're seeing, they negatively impact these communities. Like, even if they don't pass, like, it does increase suicide rates. It does increase more barrier, like psychological fear of seeking healthcare services in general. And I feel like we can't forget them. We have hospitals that are closing at an alarming rate. So we have rural areas that don't have access to, they'll only have access to one hospital that could be, religiously run, for example. And so they refuse a lot of care based on gender identity and sexual orientation, even for cisgender people. And having the Equality Act will be the ultimate line of defense for many of these folks. I mean, I don't know about your area, but in DC, we forget that, right? Because we have already a lot of protections within our local and state areas. But, for someone who's living in Arkansas, this is a major deal. And especially for trans and queer people of color. And so it's very, very important for everybody, but especially I urge, especially people in red states, and in places like West Virginia too, to really call their senators and say, I want you to vote for the Equality Act because this is how it's going to impact me. This is how it's going to impact my neighbors and the people I care about. And it's really vital, especially for rural people in particular, to advocate for that, because a lot of these senators assume that there's going to be backlash when they get back home, and it's vital for you to let them know that it's going to be backlash too if you don't vote for the Equality Act.
Thanks so much for saying that and sharing that. As we, first of all, I've left this conversation so inspired, and I continue to just be wowed by your perspective, and so appreciate you taking the time. As we move to close today, I've got two last questions for you, which is just what keeps you personally just motivated and inspired in the work that you do? What really is the joy that you find?
The joy that I find is just being able to live authentically within a community that I absolutely love. I've been in so many places. I lived in New York. I lived in Wichita, Kansas. I grew up in Florida. And every time, I'm in a new area, it's always been queer and trans people that have taken care of me, has always been there for me, has always watched out for me. And that's what keeps me motivated. Last year when we had horrific rulemaking, coming out from the administration, and they try to get rid of the equal access rule, we generated 66,000 comments into the comments portal for the Federal Register. It's one of the largest comments that the Department of Housing and Urban Development has ever seen. And we were able to stop and get them to give up on removing this rule. And it's because of everyday queer and trans people in our communities, who really all they want to do is protect our own. And that's what keeps me motivated. I've been with trans groups who are willing to go through services, are willing to go through discrimination, experiences of discrimination, just so they can come back to the community and say, hey, don't go here. And that's what we do. We look out for each other. And that's what I do on a national level, is making sure that our voices are being heard, not just broad LGBT organizations, but trans-specific led organizations, making sure that our voices are present and that we have a seat at the table like we did at the White House this week. So that's what really gets me motivated.
That's amazing. And then last question for you is just, what are you reading? I ask everybody this before we pause, is kind of what's on your bookshelf.
So I read a lot of books, a lot of depressing books. The one I'm reading now, I'm not gonna share because it's just sad given that we were in a pandemic. But I want to highlight a book that I'm really excited about that I don't know when it's gonna come out, but y'all need to definitely pre-order it. It's called Belly of the Beast, in the politics of anti-fatness as anti-blackness. Is by Deshaun L. Harrison. And it's about, it's about anti-fatness, and it's written by a non-binary person. So I think I'm excited that this is, an intersection of race, and in body image and in transness. So I'm really looking forward to this book. I think it's going to be a book. I've heard one chapter of it, and I feel like it would be very vital, especially if you're a healthcare provider, to really understand the discrimination and really understand how everything's related. This definitely would be a book I will definitely recommend, and to have better insight. So that's what I'm excited about.
Amazing. Thank you. Thank you. Dee, this has been incredible. I'm so grateful I got a chance to talk to you and just hear a little bit more about your story and the things that you're working on. And for those listening in, please, if you get a chance, please check out the National Center for Transgender Equality, the work that that D and their team continues to do up in DC to advocate for the community. And so just thanks so much for spending the time today. This has been amazing.
Yeah, thank you so much, David. Thank you so much for having me. It's been a pleasure.
Thanks for listening to this episode of Let's Talk About Healthcare. Remember, it's up to all of us to make healthcare work better for everyone, one day at a time. Catch you next time.